Bill Daughtry back on 98.7 ESPN on New York Sports and Beyond. September is Prostate Awareness Month. We had him as a guest last year, and we are very happy to welcome back Dr. Deepak Kapoor of Integrated Medical Professionals in Melville, and also works with Advanced Radiation Centers of New York. Dr. Kapoor, welcome back to the program, and I don't want to put this in the wrong frame, but it should be known that slowly but surely we are getting a hand up in the battle on prostate cancer.
Well, Bill, first let me thank you for having me back here for Prostate Cancer Awareness Month and helping me bring awareness to this important condition to the readers. And Bill, I think that was true for a long time, but unfortunately, recently we're starting to see some setbacks in our fight to eradicate this disease.
So, therefore, it's very important that people are aware, particularly men, especially when they get in that 40 to 45 age range. First of all, explain to our listeners what prostate cancer is.
Well, prostate cancer is the most commonly diagnosed solid tumor in men. Approximately 221,000 new cases are going to be diagnosed this year. And even though some people may believe that prostate cancer is an indolent disease or slow growing, the fact is that over 27,000 men are going to lose their lives to prostate cancer this year. Prostate cancer is the second leading cause of cancer death in men, Bill.
And what men, Dr. Kapoor, are most at risk to contract this disease?
Well, we know that there are certain risk factors that exist for prostate cancer. The predominant risk factors are having a family history of prostate cancer, and that's largely for male relatives like brothers, fathers, uncles on your father's side, and also being of African American descent. The risk of developing prostate cancer is much higher in African Americans, and unfortunately, African Americans tend to present with higher risk disease. There's also some suggestion that our veterans that were exposed to Agent Orange may very well be at increased risk for this disease as well.
Talking with Dr. Deepak Kapoor about prostate cancer. It's Prostate Awareness Month in the month of September. And we're talking about the dread disease that the doctor says will claim more than 27,000 people this year. And, of course, doctor, you want to find out about this, and I would imagine the annual checkup is the best way. I just had mine a few weeks ago, and the doctor told me my prostate's in pretty good shape.
Well, that's absolutely correct. The important thing that we need to understand is that over the last few years, we've actually seen a decrease in the number of men that are seeking screenings for prostate cancer. And that came out of a government recommendation in 2012 that suggested that nobody should get a PSA test done for prostate cancer, regardless of your risk factor. Now, Bill, it seems plainly obvious to anybody that kind of one-size-fits-all approach just doesn't really make sense for any type of disease entity. So we've developed a much more nuanced approach to who should be screened for prostate cancer and how often. So really the consensus recommendations right now are that everybody sometime during their 40s should get a baseline prostate cancer screening done. And once you get that baseline done, according to the results of that baseline and taking into consideration your risk factors will determine how often you should have a screening done thereafterwards. There is, as I said, no one-size-fits-all approach. Every man is different. Every man's risk is different. And in this era of customizing medicine, it's really important that people understand that they need to have a conversation with their doctor and determine what approach to prostate cancer testing is right for them. But to start off with, you're 100% right. You should start thinking about it in your 40s and get a baseline test done and then go from there.
Dr. Kapoor, you mentioned a PSA test. Now, the first time I heard about such a thing was when Joe Torre, when he was manager of the Yankees back, I want to say in 2002 or somewhere thereabouts, he found out through a PSA test that he had contracted this disease and had it taken care of, and he's doing just great now. I remember being at Fenway Park the night that he came back from his surgery to take over resume his duties as manager of the Yankees. But what is a PSA test, and what does PSA even mean?
Well, PSA stands for prostate-specific antigen, and it is a protein that is produced in prostate tissue that it's generally specific to the prostate gland, but it's not specific for prostate cancer. And that's why it's important to realize that PSA is a tool. It's not the be-all and end-all. And we need to take other factors into consideration when we interpret a PSA. So you shouldn't look at a PSA as an absolute indicator of risk for disease. It's a very good marker, and particularly in people that have prostate cancer, it's one of the best tumor markers that are out there. But as a screening tool, it is simply one tool in our armamentarium in terms of diagnosing this disease. So we look at a variety of things with PSA. We look at the PSA and how it changes over time. We look at PSA adjusted to risk. We look at PSA in terms of how much of it is bound to proteins and circulating. So it's not really just that straightforward that a PSA is just a PSA. A PSA is a tool that can be that should be interpreted by with a patient and his professional. You know, for example, I used to pitch when I was younger, and you could put a baseball in my hand, and I can't do with it what Mariano Rivera, to mention Yankees, used to do with a baseball before. So you know, it's just a tool that has to be interpreted with a patient and his doctor.
Talking with Dr. Deepak Kapoor. This is Prostate Cancer Awareness Month. The month of September is that very month. Dr. Kapoor is affiliated with Advanced Urology Centers. What are they doing? Are you doing anything special to promote prostate cancer screening and sharing the message about the disease during this month of September?
Well, our doctors work closely with the Integrated Medical Foundation, which is a not-for-profit company that's found at www.imfcares.org. And that foundation is dedicated to providing free prostate cancer screenings and improving prostate cancer throughout the New York metropolitan area. So people can go to that website and see where there are screenings in their area. Our doctors will go to many community churches and work with a number of local politicians to have screenings in their area as well. So the most important thing that people can do is understand that this is a serious disease, and that if you detect prostate cancer early, the potential for cure is substantially higher. So back in the when I was in training, and I won't tell you, Bill, how long ago that was and date myself, but, you know, we used to see that almost a quarter of men used to present with disease that has spread to the bone, which is incurable. We hardly ever see that happening anymore. Back in the before the era of prostate cancer screening, before PSA came out, which was in 1986, the 10-year survival for prostate cancer was around 50%. Believe it or not, it's now around 99%. So we've made tremendous advances over the last 3 decades in identifying men with early-stage prostate cancer that may benefit from treatment. In addition to that, nowadays we have very sophisticated tests, whether they be the way that we interpret prostate biopsies, molecular and genetic markers, that once a person is diagnosed with prostate cancer, we can, in a very accurate fashion, determine which patients should have immediate therapy, which patients are at high risk for disease progression, and which patients can we safely monitor and perhaps put off treatment until such time that their disease progresses. So, you know, the way we're managing prostate cancer now is, even compared to where it was 5 years ago, is really that much more sophisticated. And candidly, we were doing a pretty good job even then.
And, you know, Dr. Kapoor, I would be remiss if I didn't ask you the question about symptoms, but I know the answer to it, but you want to talk about insidious diseases. Prostate cancer is definitely one of those.
That's absolutely right, Bill, and it's a great point, because the most common symptom of prostate cancer is no symptoms at all. By the time someone becomes symptomatic, that usually means that the disease has progressed past its curative stage. So with a disease like prostate cancer that doesn't manifest any symptoms, the only way that you find out if you've got an early stage curable cancer is if you proactively look for it. And again, that's one of the things that I want to caution men about. We've seen in our own practice, and again, we're the largest urology group in the United States. And we have about 1.3 million patients in the New York metropolitan area that come to see our almost 100 doctors in the 55 offices we have in 8 counties here. So we diagnose more new cases of prostate cancer than anybody else in the country. Now, what we've seen over the last 3 years is that people are getting tested later, and we're seeing a shift to more aggressive disease than we used to. And that's really troubling, because if the disease is more aggressive, the probability of cure becomes a little bit more challenging. So it's really important that men take control of their own lives on this issue and proactively seek medical help, get the blood test done, get the simple physical exam, and then talk to your doctor about the results. Having an abnormal PSA doesn't mean that you have prostate cancer, and having an abnormal PSA doesn't automatically mean that you have to go on to have a prostate biopsy, or if you have a biopsy that you'll definitely have disease. So it's really important that men understand that the PSA test, the screening, is just a piece of information that they can use. The PSA test is just a piece of information that they can use to have a informed conversation with their healthcare professional and make appropriate decisions for themselves.
Final thing, Dr. Kapoor, a few moments ago you mentioned the Integrated Medical Foundation. I want you to give that website again, but we all know the great inroads that the Ice Bucket Challenge has helped to make in fighting ALS, Lou Gehrig's disease. I understand that IMF has a pie in the face challenge to help the fight against prostate cancer.
That's absolutely correct, Bill. And I myself took a pie in the face to raise prostate cancer awareness. If anybody wants to go and take a look at the video online and see me taking a pie, you're more than welcome to do so. But, Bill, I'm going to challenge you right now on the air to take a pie in the face for prostate cancer and post that video on Facebook and YouTube.
Guess it's going to have to happen. It's going to have to happen soon. Give me that IMF address once again.
That's www.imfcares.org. IMF Cares is one word.
Dr. Kapoor, continued success. Thank you for the information. And again, to take the pie in the face challenge or just to find out about prostate cancer awareness in this Prostate Cancer Awareness Month, log on to imfcares.org, or you can find out more at AUCofNY.com. Dr. Kapoor, thank you very much for your time, and we'll talk to you again very soon.
I hope so, Bill. And once again, I want to thank you for bringing this to your listeners' attention, and want everybody out there to remember, early detection saves lives.
Thank you.